We are. Welcome to COVID-19, the Orthopaedic Response. It's a production of DOCSF and the team that supports that, and UCSF. I'm your host, Shauna Butler, and we're thrilled to be joined by the American Academy of Orthopedic Surgeons as a global convener to help us address this rapidly responding and dramatic changes to healthcare, to patients, our communities, and specifically to our information and our data. And so for this session, I'm thrilled to have Herb Kelsey join us. The title of our session is Cybersecurity, Keeping Your Eye on the Ball Under Stress. Herb is the CEO and founder of Quantum Vault. Herb, you've got a lot of experience, like 3 decades or so, thinking about architecting our global information systems, thinking about how to keep our information safe, our identities safe, and increasingly, as we have rapidly adopted telehealth and telecare, virtual care, and having so many people go online at this point in time, we're seeing an increased need and demand to understand the hygiene around our data and around our technology. So we've invited you to help us talk about what our cybersecurity needs what we need to do to bring everything up to, we'll call it code. What does our technology stack need to look like in order for us to have safe and secure interactions in this format where we're using more and more telehealth? So how about if I bring your slides up?
Okay. That sounds excellent. Well, Shauna, first of all, thank you and the rest of your team for thinking of me and inviting me. I'm happy to be here doing this. I think the way that I would set it up is, yes, my background is in cybersecurity. I was the first CTO for IBM in cybersecurity, and I actually had the opportunity to be the chief architect at NSA. So this is deep in my DNA, if you will.
Yeah, I just want to say, if we're ever in this geopolitical nightmare and we need to parachute into some part of the world that is under a lot of intense issues, you're the guy we want to have as our flying as our wingman, right?
I would embarrass my daughter, who I think is listening, just to say that she does have a story about, what happens if a black helicopter lands on her soccer field at high school. But hopefully we won't have to deal with anything like that here.
Yeah, but if it does show up, she needs to get in it, right? Because it's coming for her.
Yeah, it's only for her. She needs to get in it. So yeah, I mean, what I think even casually, I think people are understanding that these systems are stressed. And they're stressed both at a practice level within the medical profession, but they're also stressed for your patients as well. And I think we're starting to see more people trying to interact via the internet, via these communication mechanisms. And there's some issues with that. And that's really what I'll cover. So I titled this a crash course in operational security, or OPSEC. So it's not a misprint.
I just have to laugh at the idea that you would call it a crash course. We're trying really hard to make sure our systems don't crash.
Yeah, well, and so what happens is that as things dismantle around you, you actually have to learn and evolve faster than it does. And so if things are crashing around us, then we have to learn faster than that. And that's really, so I'm very comfortable with the terminology if it helps people understand. So, we've got some.
Remember, this is a medical environment. We don't like crashes. Okay,
I understand, but we're gonna have to. So we don't like crashes, but we also don't like viruses. And
no.
The computer world picked up the idea of computer viruses. So we'll talk a little bit how to defend against that. So maybe I'll redeem myself.
Okay.
So the way that I framed this, and I only have 2 slides, folks. So hopefully there'll be some time for questions. But the way that I framed this is essentially, what guidance would I give to someone, say, from the State Department, an ambassador who was going into a hostile environment with all their technology? So that's the frame for the talk. I did want to give the audience just a quick piece of background in terms of where I've intersected with the medical community and the government. So I did help define the HIPAA and high-tech standards. I've also had a lot of work with CMS and doing predictive analytics. And so that led me into this kind of frame. And then I'm currently working with the US government. They asked me to help support electronic security for voting. And now with the pandemic, they're asking me to see what I can do to support some of these electronic security activities more broadly. So that's what kind of leads me into this and makes me feel comfortable, at least trying to have a conversation with you about what we can do to better protect ourselves. So here's the slide. It's going to be here for a minute.
I like how it has so many pictures on it.
Yeah, I was trying to find pictures for each of the things that I was talking about, but I figured, since you were telegenic, we would be okay.
Yeah, thank you for that.
I wouldn't have to worry about the pictures. All right, so a crash course in operational security. So taking care of your digital health, taking care of that digital well-being is a combination of the people that you're interacting with, the technology that you have at your disposal, and the processes that you follow. And so what I'm going to try and take you through is a way that, from a personal perspective, you can better secure yourself and what's going on around you. You can also do this in a small practice. Usually, if you're in a very large institution, there are a number of people like me and smarter than me that are running around telling you, no, you can't do this, or yes, you can do this, and telling you to update your phone, that are taking care of it. And so my perspective here is really, what can you do from your personal purview? What can you do from a procedural standpoint? And what can you do with a set of tools? And so that's the background for this. So the first thing that I would want to make sure people understand is that hackers love medical records. And the reason that hackers love medical records is because it's deep background information on patients. It's durable. It has every place you've worked and every place you've lived, and it usually has a lot of just really good content to steal an identity. So the difference is, I could go out onto the internet and get an active credit card for pennies. If I wanted to get a medical file, it would cost me, over $100, $200 on the dark web. So the threat is real because the medical information is so valuable to people that have bad intent. And then the other threat is also important, which is just people wanting to be malicious and destructive. So that's the frame. So the first bullet is around privacy. So I'll take each of these four. So the first thing I would say is that in any of your interactions electronically, you have to realize that privacy is going to be a concern. And so a simple step that you can take that will work on your phone, on your home computer, on your office computer, is to use a virtual private network. And what that does is it makes sure that any interaction that you have between the parties is fully encrypted and can't be looked in on. And one of the products that I like a lot is Larva. I'm going to be pitching products because I wanted to be practical about giving you guidance. So at least this is a starting point for you. I have no other interest than helping you go into a hostile environment and be safe.
So when you said a VPN, are you talking about an individual practice or an individual person, or both?
So it can be both. And so the thing to realize, and I get to this in a little bit, but the thing to realize is that each one of us that's touching a network, a hospital network, our practices network, whether it's a patient or a doctor or a nurse, is an on-ramp. So it's very simple. Hacking threats usually originate from one person clicking on one email, and then it's the term computer virus. It then spreads from there. And so, again, the larva is free. It's something that you can put on your phone. I use it on my phone when I go to Europe. It's something that you can use on the machines in your practice. So yeah, it's something that you can go and add to your phone right now, type of thing. And that's really the level of guidance that I'm trying to give everyone out there in this community. These are things you can go do, and these are things that will help.
On that, I was just say one of the things that we've heard so much is all these hospital systems being hacked and data being pulled out. So right. The VPN is really your protective layer, so that all the people who are interacting with your system, you're keeping your system safe.
Yeah, it's one of. So, people do ask me at times, give me the answer, give me the one thing that will help. It doesn't work that way. It's people, it's processes, it's technology. And so I'm talking here about a piece of technology. In a minute, I'm going to be talking about a piece of process that's important for you to be able to to understand as a concept to thwart hackers. So it's not just one thing, it's multiple layers.
Okay.
So next one, if you're exchanging data, almost every PC or Mac, there's something called zip. Zip the files. If someone's going to exchange information, if I'm going to exchange my patient information with you, I should not just send it to you in an email. I should zip it first. I should put a password on it. You're going to hear this pretty consistently. Put a password on it. So you zip that file. It's now encrypted, which means no one can unlock it without the password. But here's the point about separate channels, and this is the concept. Don't send the information along and then put the password in the same email. Put them in two separate emails, because what a hacker loves is when they intercept something and you've laid everything out for them. You've got the data file, it's encrypted, but you also have the password there, and you've made it easy for them. Hackers don't like things that are difficult. And so if you have the patient send the files encrypted and then send you the password afterward, you've made it much, much more difficult. Again, from a privacy perspective, again, and I'm just thinking again, individuals going to an environment, what can I do? I tell people, use WhatsApp. It's fully encrypted end to end. It's got a lot of great features. If you are doing something, quote, less formal, more casually, it's excellent. If you need something that's HIPAA compliant, I put a number of options down below there. The link is there, and these are each HIPAA compliant options for chats. But if you just need something quick, you can put WhatsApp on your phone, and it's excellent. All right, so moving on. The idea of identity, which means, do I absolutely know who I'm dealing with? And it turns out that identity is one of the most challenging parts of cybersecurity, and where I've spent a majority of my career and time. But I wanted to point out a couple of things. When you're video conferencing or setting up these video conferences, it's happening so that patients can interact with their doctors, but it's also happening so patients can interact with patients. And sometimes, that's an end-of-life situation or a fraught situation and emotional, and nobody wants that interrupted. So there's a term out there called Zoom bombing, where hackers have been able to interact with families and people in ways that are just inappropriate. And there's FBI guidance out there on how to deal with it, but I'll keep this really simple so you don't have to read the 4 or 5 pages. Use a password on your video conferencing. The reason hackers are able to get there is they're able to scan for all the open conferences. They look for the ones that don't have passwords on it, and they Zoom bomb those. And so I would just urge everyone to simply use the password on your Zoom call, on your video connection. The other thing that I want to go into there in terms of conferencing is I know that typically a lot of hospitals and areas don't want electronics, but I'm assuming they're making exceptions in certain cases. But there's also the concern about what happens on the network. And so if you've got a patient or a family member who's saying, they won't let me do this, they won't let me do this, one of the things to explain to them is simply ask or tell the hospital that I'm going to use my personal phone connection. I'm not going to get on your Wi-Fi. I'm not going to use up your Wi-Fi network, and I'm not going to add my phone to your system. And they may very well get more comfortable with what you're doing. From an identity standpoint, I would just say one of the things to also understand is that, at least in the US mail can handle US secret data. And so if you're going to send something, I know it seems archaic, but if you're not sure, have them send it in the mail. It's actually very well protected. And then this is also the research that I'm doing at Quantum Vault, the research that the government is interested in how to secure things over the internet. But
I actually had a question on that. So the security is one piece of it, but also the reliability. And I want to go back to that point where you were talking about having a sensitive conversation. And we're going to be increasingly doing that, whether it's end-of-life care, giving somebody a bad diagnosis.
yes.
There's going to be a lot of those. There's nothing worse than being in a very sensitive conversation and the line going down.
Yeah.
So you don't want somebody coming in uninterrupted, and you also want to have the stability. So how do you keep the line secure from the standpoint of, when you need to have this sensitive conversation, that what are the things that you can do to protect, to make sure that the call or the line doesn't drop?
Yeah. So if in a meeting setting, I'd say, wow, we have to take that offline because there are so many facets of that. I would say the simplest thing is don't move.
Okay.
In other words, if you're doing this office, if the patient and the family members are spread out and it's distant, once you get a good connection, don't physically move, because that will change your relationship to your Wi-Fi or change the relationship to your reception. And that's typically what happens. So that's my shortest answer.
Okay. Like I said, we're having a lot of those, and that's just a really simple thing that if you can avoid something that really is a simple thing, how crazy is that in a moment of really sensitive information, then all of a sudden you have a connection drop. So
yeah, well, I mean,
don't move. Don't move.
Yeah, your inclination is to pace and be worried and fidget. Don't move around the house.
Okay.
Don't move around the office, and you've got a higher likelihood. All right. 2 more bullets. See, Sean, I told you the slide would last, didn't I? Yeah. Okay.
It's durable. Right. I give you that.
Right. It's a durable slide, right? Okay. So business continuity. So this is kind of at the practice level, and it goes back to my comment that everyone is an on-ramp into your system. So a couple of things that you can do. If you're interacting with your patients via email, give them guidelines. Tell them that you're not going to ask them for their password. Tell them that you're not going to ask them for for their social security number in the email. Give them some practice guidelines so that they can avoid the scams that are out there, and that's the below, or the link below. But just establish some guidelines where some of you have probably seen this from like Apple or insurance companies where they say, we will never ask you for your password. So establish some guidelines in that way. All right, next one is important, just computer virus protection. The one that I would really recommend if you're not using anything, or even if you are, is something called PCmatic. Um, it's a gentleman that I know, but he's been well respected within the DoD, and it's an important difference. Most virus protections try and understand what the threats are and build a vaccine, a computer vaccine, if you will, for it. PCmatic is the complete opposite. And what they do is they whitelist all the programs that they know are safe. And so, in terms of protecting your system, it's extremely, extremely good at it. And so, again, it's small fee, great protection in a small office, great protection in your office, because remember, or in your home, because remember, we're at home doing these things, and if a patient sends you something with a virus in it and you click on it, your machine's infected. So, it's just the hygiene that you need. Then, specifically for practices, in thinking through this, I'm concerned about people getting ransomware attacks. Here in the U.S., the city of Atlanta was held hostage for several days because someone sent ransomware to one of their people, and it spread out in the system. And what ransomware does is it takes all the files on your computer, it encrypts them with a code that you do not have, and then you get an email saying, if you want your files back, you have to pay us in some form. It's usually Bitcoin, or we're just going to let your files be destroyed. And it's rampant, and I'm concerned that it's going to hit this community. And so there's a product out there called AppGuard. It's based on technology that was produced to support embassies in the State Department while I was at NSA, but it's available to the public, and it is the best assurance against ransomware that I'm aware of. And so at least if you have that awareness, but I think it's important to think about this through the lens of how do you continue your business if in fact you're being attacked. All right, so last formal point is disinformation control. So, the concern here is an article from yesterday or 2 days ago where, the title of Coronavirus Pandemic Unleashes Unprecedented Number of Online Scams. I mean, it's hackers don't waste an opportunity to exploit a situation, and this is a perfect one because nobody knows who to listen to is really where I see it taking place. And so what I would say is, as professionals in your community, as professionals in your personal community, I'm sure that you're getting questions about what do I do and what do I pay attention to, and is a scarf really better than a mask, or how long should whatever that is. I know you're being asked as a resource. What I would suggest, because disinformation is the cornerstone of hacking, it just is for you to actively, and pick whichever ones you want, but actively endorse credible sources of information. So tell people where they can go, tell people who they should listen to, convey your stature, convey their respect for you, and transfer that to somebody credible like the CDC or the World Health Organization and so on. So whatever you can do to help people know where the credible sources, especially since they're online almost 7/24 now and being inundated, will help separate the bad information from the credible information. So that's my one slide. I am happy to take questions. What I would say is that my email is on the slide. I think it's going to get copied to the chat screen. And what I would offer to this community of almost 5,000 people is I will certainly do my best to address any questions that you send my way, as you know, as for as long as I can. That's it. So, Sean, if there are any questions, I'll be happy to try and address them.
Yeah, there are a lot of questions. So here's a simple yes or no, short one. This is from Richard Santori, and he wants to know, we use Nord for our VPN. Is this a company that you have a favorable view of?
So I would have to take that offline. I'm familiar with Nord, so my answer is no. But it doesn't mean stop using them, because you asked a yes or no question. So no, I do not.
Okay. Richard, if you want to have a follow-up on that, please go ahead, and Herb can address that. And then from John Macy, he wants to know best security for using Mac, not a PC, Mac systems, especially now that we're using telemed and particularly more often from home.
So great question. So Mac specific, any VPN that you can find, any credible VPN that you can find that will run on a Mac is great. PCmatic, I know, runs on a Mac, and so I can suggest that. The Quantum Vault stuff would run on a Mac. I can't remember all of them, but I tried to give you the frame of what it was, and so if you can find your equivalent on the Mac, you'll be fine.
Okay. And Herb, I was just going to ask you if you can move a little bit more over into the center of the screen. I think when I pulled your slides down.
When you pull me over, I move. All right.
Exactly. No, I think I'd like to see all of your beautiful smile.
I didn't move. That's my practice.
No, I was going to say you were great.
Go ahead.
So in just going at the conceptual level,
Yes.
Let's talk about from the standpoint of if you have, in your practice, it is so vitally important to business continuance to make sure that your systems are safe, correct?
Yes.
Yeah.
It's critical.
So, and I want you to just name it out there. So if anybody's thinking, I don't think I need to prioritize that in all the budget of the things that I need to have. I mean, I've already got a bunch of overhead. Why do you need to prioritize keeping your data systems secure?
If you don't keep your data systems secure, you can't help the very people that you are trying to help. You are out of business. You have lost your ability to function. You've lost their patient records. You have exposed them, every one of your patients, to identity theft for the rest of their lives. And so that's the thing that I would say is, cannot be cavalier about your data hygiene, because any mistake on your part has, in that regard, has long-lasting effect on every one of your patients and shuts down your ability to do the work you're trying to do now.
So your whole business enterprise really is at risk. I mean, the more I spend time with this, the more I think about it is on a very personal level. What would life be like if I lost my phone? And I just kind of look at that and I think it would just be easier to start life over again. It's your ability to operate.
Right. So it's not losing your phone. As a hacker, if I have your medical records, I can own your house in 3 months. If I have your medical records, I can set up a second mortgage on your home. You never know, and I take the money and you're responsible. You're evicted. As a hacker, I mean, so it's losing your phone, it's losing your house, it's losing your car. It's real, and then not to mention just the the personal ordeal of everybody knowing very private things about you. Those have been exposed as well, and so it's just to me it's elevated and it's important, but I mentioned the first point. It's important for you to be able to continue your practice, because what the city of Atlanta found and others found is that once you're hit with a ransomware attack, you're done.
Yeah.
You don't get to continue.
Yeah, you really are. I mean, you're just paralyzed.
Yes.
So now that we've made, it's very clear why you need to prioritize that within the structure of your practice. What vendor do you need? what type of personnel do you need internal? What can be outsourced? What would a business organization for a practice? What would the personnel look like to make sure that you've got the talent and the resources that you need to keep your information and your data and your communications secure?
So again, whoever's asking that or has that concern, email me. I'll try and be brief here. There are certifications that we set up out of NSA. One of them is called CISP. CISSP. It's a computer cybersecurity certification. So depending on the size of your practice, you want to look for somebody who's certified. There are some other network certifications, but there is a cybersecurity certification that you would look for. So you would want an individual such as that on your staff. You want somebody with an IT background on your staff that understands how to protect Macs, PCs, networks, and individual devices. And, I think in email, I could probably come up with 2 or 3, key questions. Have you worked with this? Have you installed this type of thing into an environment to kind of, but those are the types of skills that you want to protect you and the certifications that would apply.
Okay. And if, heaven forbid, you end up with a ransomware threat, Mike Ryan is asking, what do you recommend if you do get a ransomware threat?
Pay them. It's easier. I mean, in other words, there's a demarcation point, right? What I've advocated here today are steps that you can take where you don't face that inflection point. But if you're at that inflection point, pay them and keep your business open, keep your medical records, just pay them, because from a technology standpoint, it is a perfect storm, and it's really not recoverable. So you pay them.
I was going to say, that's what I have seen. And then there are insurance policies or special riders, I understand, on business continuity that are starting to cover this. Is that something that you recommend putting as part of your business plan?
I mean, I would, if we're in this crisis moment, I would say practice the hygiene that I've described.
Mm-hmm.
Once we're out of a crisis moment, I think that prudent planning, it's not that hard. The 4 points that I put up there are really the 4 points that are critical. I know a lot of professionals who do make it more complicated. I think because I've been doing this for so long, my choice is to help make it simpler.
Mm-hmm.
And so, but again, I would demarcate during the crisis, fix everything that you can. After it, plan for the next one. I just see a question down here. Someone's asking, problem with WhatsApp is need to use cell number. I think all I would say is, again, I was just trying to find ways for people to be able to communicate safely in multiple modalities. If that modality isn't correct for you, I respect that. But I was trying to give very general advice. If I'm a patient and you're my doctor and we can only connect via cell phone, then, and you want that to be secure, it's a way to do it.
Yeah. And just on that topic, there increasingly, as we've gone to open notes, as our healthcare professionals are increasingly showing up in social media channels and being more available to the public as well as to their own patients. Many of them have said, look, just by giving my patients their phone number, sometimes that psychological security of knowing if I needed to reach them,
that's right,
then it actually decreases. So many of the colleagues that I have who have been sharing their phone numbers pretty readily, they haven't seen that it's been abused. And of course, it only takes one person to abuse it to make it.
That's right. Well, so for instance, on WhatsApp, so let's say, and I mean, there are other products out there like Signal, but on WhatsApp, you can block people. I mean, so it's like if you find that a particular person or family member is, for whatever reason, abusing the privilege, you can block them. And so there are some niceties to it. But again, my frame was,
It's a tool that, yeah, if it works for you.
it's a tool. Oh, and the frame was, if I've got an hour to talk to somebody who's about to go into an ambassador who's about to head off to a hostile environment, Mr. and Ms. Ambassador, here are the 10 things that you need to pay attention to. Let's get your phone set up. Let's get your laptop set up and go. And you'll be much safer than if we hadn't had this discussion.
So we've got a question from Alonzo Sexton, who's asking, what video chat app do you find the best for the mix of security and quality?
Okay, so again, these very specific questions are challenging. I like WhatsApp because it lets you go international and it's fully encrypted. But again, you can do the same thing with FaceTime. So it really depends on, what your connection points are. Is it Mac to Mac? Is it Mac to cell phone? Is it cell phone to cell phone? But again, I would just say WhatsApp works if you need something that is that's HIPAA compliant. I tried to provide that from text messaging, but whatever mode or whatever product you pick, use the password settings, right? Because Zoom is great. It's just people are opting for convenience, and that's the biggest problem that we have with the internet. Everyone thinks it's safe and it's not, and everybody's going to learn how unsafe it is. And I've been railing against that in my professional capacity for 20 years, that the populace does not understand that the most dangerous thing they interact with every day is the internet. And if you don't learn how to compose or conduct yourself on the internet, you're going to be burned. And that's what's happening right now, is people are finding out how fragile it is, that it was never built for security, that it is the most invasive thing that you can work with. And if you don't take certain steps, you've got a problem. And so again, back to the video chat, pick whichever one. The best one's going to be how you use it, and the best one's going to be if you send the link to your video chat in one email, and then the password to your video chat in a separate email, and then you're good.
So Herb, I want to tell you, I love the security guys. I love the IT guys, but you always put the fear of God in me after I talk with you. So from the standpoint of I love the internet, and I just need to go safely about the internet. So
you need to go safely about the internet. Look, it's the difference between driving down the highway with your kids and your dogs running around your car without seatbelts, with the windows open, doing 100 miles an hour, doing the bird box thing with the windows blacked out. That's all. And so the reason that you have the fear of God is because you're not following the practices that are a little bit inconvenient. If you follow the practices, you're fine.
I was going to say, from the standpoint of, I don't find it so much inconvenient. I sometimes find it intimidating because I'm not sure I know how to navigate my way around. And I'm always afraid if I click something, I'm going to lose a bunch of things. So I think part of this, in addition to hygiene, we need to develop a set of competencies. And as we have more robust opportunities, it's sometimes, the complexity of checking these different things, and then things don't work. So we're all learning together. Yeah, we're learning together, and really grateful to have somebody with so many decades of experience to help us navigate those things. And like I said,
you can say I'm old. Go ahead. Yeah. It's fine.
No, you're wise. You're wise. You're wise. And okay, I will say, as we're going into these new uncharted territories, I am so glad I got you in, being my wingman on all of this. So
you have my email. This community has my email. I will do my best to catch up. I will do my part on election security. I'll do my part on identity, and Quantum Vault is kind of the pinnacle for me of my life's work. So hopefully I'll be able to get that done. But I am here and ready to try and address specific questions at this email address.
Well, thank you again. Really appreciate you joining us for this. this segment of the COVID-19 orthopedic response. And we'll see you online safely. Bye, Herb.
Yes. Bye-bye. Thank you all.